Hello, I'm Yvette Torres. Welcome to another edition of The Road to Recovery. Today we'll be talking about the language that we use on issues related to addiction and recovery. Joining us in our panel today are Daphne Bell, Director of Communications, Treatment Alternatives for Safe Communities, Task Incorporated, Chicago, Illinois. Dr. John Kelly, Associate Professor in Psychiatry, Massachusetts General Hospital, Harvard Medical School, Boston, Massachusetts. Laureen McNeil, Director, Bureau of Recovery Services, New York State Office of Alcoholism and Substance Abuse Services, New York, New York. Carlos Hardy, Director of Public Affairs, Baltimore Substance Abuse Systems Incorporated, Baltimore, Maryland. John, what role does language play in forming public opinion on addiction and mental health issues?
I think language plays a critical role in the way that, after all, it conveys the meaning of what we're trying to express. And so I think it plays a very important role, and we should think carefully about the terms that we use because of that.
So why does some language impede the understanding, Laureen, of our field and the way we refer to people?
Well, I think particularly now that we have this new recovery framework, people are holding on to the old language. And the new language really holds the fullness of the framework. It really shows the validity of the framework. It shows the reality of recovery. And so the fact that people are holding on to that old language is really impeding us from moving forward into this new framework.
And Daphne, what are we talking about in terms of the old language, the new language, and the transition that we're trying to create?
Old language is using phrases like addict, junkie, user, substance abuser, calling people by, rather than calling people, then we're using terms that define them by an action. And that is inappropriate. New language refers to a person, a John, a Laureen, a Carlos, Daphne. We are people first and foremost, and we may be people with histories of substance use disorders or whatever term that we choose to use, how we choose to call ourselves. But the old language talks about a person in association with the illness. The new language is the person.
The illness or a value-laden opinion about that person and not even referring to that person.
Thank you, yes. The old language is more judgmental. It makes moral statements and moral judgments. And the new language talks about this as a health issue. This is a health issue that we're dealing with, and the old language doesn't acknowledge that.
And Carlos, did that affect you in your path to recovery?
It did early on. September is really important for me because it happens to be my anniversary month in recovery.
It's also Recovery Month.
It is also Recovery Month. Thank you for pointing that out. But September 23rd will represent my 17th year as a person in long-term recovery. And so I go back to my first opportunity to be in the treatment and some of the labels. And what was really interesting is that folks in the program themselves were labeling themselves. So you could be in a 12-step meeting and it's recommended, particular fellowship that I attend, that you identify yourself simply as an addict. And folks thought it was real cute to identify themselves as low bottom or a rock star or some of the things. So for as much as society and the public labels us or attaches labels, early in the recovery process, folks had a tendency back in the day to label their own selves as well.
Mm-hmm. And John, therein lies the conundrum, I think. The notion of the mutual support process does promote and sustain a certain type of language that would tend to perpetuate, I believe, the very labels that we're trying to overcome. Is that correct?
I think so, because these terms are so embedded in our culture and our psyche that it takes a long time for them to change. Even in spite of, as Daphne was saying, the new scientific knowledge we have of the nature of these disorders.
Talk a little bit about that.
Well, in terms of, we've learned a lot in the last 25 years in terms of, I think particularly neuroscience findings that have really elucidated the mechanisms, the kind of brain damage that occurs as a function of chronic exposure to alcohol and other drugs. And this has really helped us really understand what's really going on and why people who historically have been viewed as having weak character and weak will is really a function of brain damage which impairs their ability to regulate those impulses. And that's, I think, very, very important. And I think, given that understanding, I think it's very important that we establish and convey the new terms, as people have talked about. For example, calling it a disorder if it's a disorder, a substance use disorder. And of course, when you use a term such as calling someone as having a substance use disorder as opposed to a substance abuser, the distinction there, I think, can be, when you stop and think about it, can be quite clear. One's more of a medical connotation, the other one's more of a judgmental and identifying the individual themselves as the disorder, instead of, as Daphne was saying, a person with the disorder. Mm-hmm. But it is very difficult, I think. It takes a long time to change these terms in the cultural psyche. And so this is why this is such a good idea.
Well, hopefully today we can enlighten folks.
That's right.
and
Exactly.
encourage them. Carlos, I think you were going to say something.
I think we've done a great job of identifying and quantifying the scientific and the clinical aspects of it. I think, and so we have slogans that we back it up with, like treatment works, recovery happens, or treatment is effective. But my concern or my issue is, how does that message resonate within non-traditional groups, if you will, the community person that has a treatment program as a neighbor? What kind of message do we convey to them beyond what they see? And so I think it's real important that, and I think Bill White talks about this, that the greatest stigma reducer is when you begin to promote these relationships, the interactions between communities and people in recovery, or the interaction between treatment programs and the neighborhoods where they're located. And I think it's really, really important.
And Laureen, I want to go into the treatment system itself. Are there opportunities for the treatment system, the individuals that are providing the treatment, and you're in a state entity, and certainly this program is sponsored by a federal entity, are there opportunities for those entities to look at the change that needs to happen in language, and what can be done about that?
I think it's very important. I do think it's an opportunity. One of the things that we're doing in New York is that we've taken the language that SAMHSA has promoted, and we have sort of tweaked it. We have a one-pager, two-sided, that we are going to be taking to every meeting with a provider, every convention, everywhere, because we do think that language is important, and there is an opportunity. We are working with the treatment system on this whole move towards the recovery framework, and language is very, very important. The whole idea that recovery is self-directed. We need to be able for people to self-talk. One of the things, when John was talking about the disease, one of the things that I remember very clearly is how the addict feels about themselves and how the language really impacts you. Being called a junkie, being called an addict, you begin to believe that. You begin to enact that behavior. So it's very, very important that while people are in treatment, and not only treatment, the other pathways, the faith institutions, we want to get this information to them, the mental health system, the child welfare system, all different systems. We want to get this language to them so that people will begin to adapt this language and begin to get it to the people that they serve. And it's very, very important.
Just briefly, give us your own example. I know you're in recovery. Give us your own example of experiences that you may have had where you were able to correct someone or educate someone.
I remember when I was a program manager early in my recovery, and I actually went out to a program and I was reviewing the program, and I was asking about certain things that I saw in certain records. And the director of the program said to me, after I questioned her for a while, and this was someone who was a leader in the field, she said, well, you know, they're just junkies. And that really hit me, because those people that she's talking about who were just junkies, she didn't realize that I was one of those people, you know, and I have not forgotten where I came from. And so to say that, it really shows me your whole thought, and how can you help people to recover if you believe, if you have this belief about them.
Mm-hmm. And when we come back, we're going to continue to chat about both inside our field and externally how to deal with the language issue. We'll be right back.
Language plays a critical role, like the media, when we are talking about media, when we're talking about images, when we're talking about an individual's sense of shame or guilt or expectation. Language used by those around them, or even language that they use themselves, about themselves, can affect their willingness to pursue a recovery, to pursue rehabilitation. We, on one hand, want to offer hope. On the other hand, we want to stress that being in the throes of your addiction is not a good experience, without casting aspersions on the character of the person who has the problem.
Where's Mom? Did she forget me? I wonder what happened to her. What if I get left here?
Drugs and alcohol may make you forget your problems for a moment, but that's not all you forget.
My mother worked hard to be in recovery, and I love her for that.
For drug and alcohol treatment for you or someone you love, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
I had no idea it was going to be so hard. I didn't know what to expect. You hear the stories, but I never took any of it seriously until I found myself here. And then I realized I was going to have to work hard for my recovery.
If you or someone you know has a drug or alcohol problem, you are not alone. Call 1-800-662-HELP.
Recovery was the hardest job I ever had, and the most important.
Brought to you by the U.S. Department of Health and Human Services.
Well, my passion is really advocacy around treatment and recovery issues. I've had the wonderful career over the past 16, 17 years of being a direct service provider, being a treatment and recovery advocate, to heading up a large advocacy organization, to actually working inside right now. And my primary purpose is to make sure that the next person, that person that's still out there using now, when they do have this aha moment, that the system is ready to welcome them and to embrace them and support them as they begin their journey on recovery.
What recovery has brought to me is an ability to take it to the next level and be vocal about it, not be ashamed, you know, not hide behind a wall because you're afraid that, oh, well, God, they're going to know that I'm a recovering addict. Well, I like to say that I'm in long-term recovery as opposed to an addict or an alcoholic, because there's more positive sounding. Because people still run with, well, addict, ooh, bad. Alcoholic, ooh, troublemaker. But long-term recovery has a nice twist to it. And if I can't give it back, I'll lose it.
Carlos, coming back to our own field, I think Laureen mentioned some issues related to how her coworker referred. But should we be looking internally first and seeing how we ourselves feel about those that we serve?
I think it's important. As a matter of fact, I believe it's critical. What's really unique in my human service career of about 16 to 17 years, I started out as a direct service provider and managing supportive housing programs where a lot of our residents were coming from treatment programs. And then I worked 5 years as a drug treatment organizer, looking at the whole NIMBY issue and what
NIMBY is?
Not in my backyard. And there's a whole host of acronyms that you can use. And then I actually was executive director for the National Council on Alcoholism and Drug Dependence for a couple of years. And all of that to say is that I focused a lot on the advocacy part of it and pushing the system, if you will. And what I began to see once I came on the inside with my current organization is there's stigma and discrimination and biases within the field, probably just if not to a larger degree than what you see outside. I think the whole issue of medication-assisted treatment is one that we just don't want to talk about. I think some of it is that the workforce is basically trained in a certain modality, a methodology, or clinical approach, and don't want to veer far from that approach. But in this new day and this new age, we're focusing more on a strength-based approach, a person-centered approach, more so than identifying the person by an action.
And John, should we be looking internally first? And if so, how do we approach the education of our field first? You know, because as we're sitting here, you know, we're talking about how everyone else perceives, you know, their moral value laden approach towards this field, and how do we deal internally?
It's a good question. I think we have to treat it the same way as we treat individuals trying to convey the message outside of the field. It's very ironic to me that in the studies that have been done, they've been done a lot with mental health clinicians, actually, who are professionally focused in the area of addiction and mental health, actually have been shown to hold very biased, prejudiced, stigmatizing attitudes towards people. Clever studies that have been done have shown this. So what you're talking about seems to be supported by empirical evidence, which always is kind of baffling when you think about people actually educated in the areas that they're actually, and still hold these maybe implicit unconscious biases that can be elucidated through these studies.